What is a doctor's weirdest case of a patient accurately self-diagnosing? I was finishing my overnight shift in pediatrics when the waiting room doors opened. An exhausted mother walked in, practically carrying her 8-year-old son who looked pale as a ghost. Something in her eyes told me this wasn't their first hospital visit. "We've been to 4 different hospitals," she said, voice trembling slightly. "Nobody can figure out what's wrong with him." I pulled up his medical record and my heart sank. For 2 years, this kid had been shuttled between specialists like a medical hot potato. Dozens of visits, hundreds of tests, and a file thick enough to stop a bullet. Fatigue, unexplained weight loss, joint pain, recurring low-grade fevers, and occasional rashes that appeared and disappeared without explanation. Every doctor had their theory. Rheumatologists suspected juvenile arthritis. Oncologist ruled out leukemia, but suggested more testing. Infectious disease thought maybe atypical Lyme disease. Neurologist wondered about early MS. Psychiatrist gently suggested it might be psychosomatic, stress-induced from a troubled home. But every test came back negative or inconclusive. As I examined him, I noticed how he winced when I touched certain joints. His skin had a grayish undertone, and despite being only 8, there were dark circles under his eyes that made him look decades older. He seemed exhausted in a way no child should ever be. "They think I'm making it up," his mother whispered when he dozed off. Her eyes welled up with tears that refused to fall. "The last doctor suggested Munchausen by proxy, like I'm doing this to my own son for attention." She'd clearly spent the past 2 years watching her son suffer while being treated like she was either crazy or criminal. As I reviewed his file again, she suddenly said something that stopped me cold. "Do you think it could be toxic mold exposure? Black mold specifically?" I nearly dismissed it. "We get plenty of amateur web diagnoses from panicked parents who've gone down internet rabbit holes," but something in her voice made me pause. "Our basement flooded 2 years ago," she continued, more confident now that I was actually listening. "Right when his symptoms started. The remediation company said they fixed everything, but my son's bedroom is directly above that area. I've mentioned the flood to every single doctor, but nobody has tested for mycotoxins." She pulled out a worn notebook filled with meticulous daily logs of her son's symptoms, along with environmental factors, diet changes, and medication responses. "The symptoms match perfectly," she said. "The joint pain, fatigue, cognitive issues, even the rashes. I've been researching biotoxin illness for months. It explains everything." I ordered the specific blood and urine tests that afternoon, despite knowing some colleagues would roll their eyes. They came back 3 days later showing dangerously elevated levels of several mycotoxins, particularly those associated with Stachybotrys chartarum, black mold. I called her immediately, and for the first time in our interactions, she broke down completely. Not from grief, but relief. Finally, someone believed her. Finally, they had an answer. The next day, they had their house professionally inspected. Behind a seemingly innocent-looking wall in the basement was one of the most aggressive black mold infestations the inspector had ever seen. The remediation company had simply covered it up, allowing it to grow undetected for years, silently poisoning the young boy. They moved out that same week. 3 months later, her son walked into my office for a follow-up. The difference was shocking. His blood work showed no trace of mycotoxins. All symptoms had completely resolved.